So it is important for us to discuss a little bit on HPV because it's directly related to all the pillars, because it is almost 100% of cervical cancer is caused by HPV infection. So this is another reason that actually cervical cancer going to be the first preventable, or the first the first preventable cancer, and the first cancer going to be or able to be eliminated from the world, because the causative agent we know, okay, which is the infection. It's not like other cancer, no, it's a genetic part and unknown, and other etiology that we cannot understand. So talking about HPV, I think I mentioned a little bit on my previous series of in STDs. I repeat it. HPV is the one of the commonest STI. So it is a commonest STI, but it's not STDs. All right. So it doesn't cause this. It's not a STD because it is asymptomatic and doesn't need to be treated. Okay, but it is infected or transmitted through sexual contact. So this is most common STIs. Means that a majority of women actually will get HPV infection any point in their lifetime. Okay, it's quite common, and because of the etiology of cervical cancer is HPV infection. So as we know, we can understand now the HPV infection. It is preventable via vaccination. There are reliable vaccines over there. So it is preventable first because of the vaccination. Another thing is because of the screening, as we go later, that HPV, that how cervical cancer progress from HPV, then CIN, then cancer. We'll go in the next slides, few slides. Okay, so there are many types. There are more than hundreds type or variant of HPV, and there are only about 14. We call it oncogenic HPV, or the other formal name is HR-HPV, or high risk HPV. So we are talking about high risk. It's not high risk. This is not high risk behavior. This is not high risk factor. We are talking about high risk type of HPV, which is 14 types. And as I mentioned earlier, type 16 and 18 is being the most popular and most common to be related to cervical cancer. But there are others, high risk type. Apart from that, actually there are many more that we call it low risk type of HPV, means the non-oncogenic HPV. But it is important to note that type 6 and 11 associated with the genital warts, anogenital warts. So it is important to know because this is part of covered, part of types of HPV that covered by our vaccines today. So as I mentioned earlier, 99.9% of cervical cancer is from the HPV. So it's considered like necessary. Means if you don't have HPV infection, never has HPV infection, you won't get cervical cancer. As simple as that. That's the understanding nowadays. Unless you're talking about 0.01. 0.1% of the case that not related to the HPV, rare types, and it's not to say not important, but because of the rarity, so we need to consider the one that we know the cause and we can prevent. Okay, so it's quite common, like I mentioned, a majority of the women, actually about 90% of women that had a sexual contact, even though with single partner, had a risk, had a chance of getting HPV anyway in their lifetime. But at one time, okay, it is estimated about 10 to 30% can be found to have any HPV DNA present or tested in their cervix. And Malaysian population, a small urban study by Prof. Yin Ling of actually is about 5 to 7%, slightly lower than the global percentage. But no, we don't have a nationwide study because of our coverage of cervical screening is not that good. yet, as yet for now. So just as a repetition, it causes cervical cancer. I mentioned earlier, 90% of deaths of cervical cancer occur in low and middle income countries. So if you see even the mortality rate, okay, means that if you get the HPV and cervical cancer, the chance of the woman die from the disease actually higher. The chance is higher in low and middle income countries. All right. So not only the rate or the occurrence is higher, but the chance of treatment, the chance of survival even lower if you get the cervical cancer from those low and middle income countries because of the availability of treatment, etc. So it is important. Actually, that's why WHO take it very seriously to prevent it rather than to develop way or develop investing into treatment. We should invest more on the prevention. Okay, this is I think in the next slide. So it's very important for us to know that cervical cancer develop over the years. Okay, so long years. It's not like developed suddenly. So from HPV infection, in between about 10 to 15 years, actually, they will have what we call a precancerous lesion, or what we call CIN. Cervical intraepithelial neoplasia, CIN. It is a precancerous. It's not a cancerous lesion. It is a lesion or a changes in cells in epithelium because of persistent HPV infection. Means not all HPV will cause this actually, but some of a woman cannot clear the virus by themselves, and causing these cellular changes. All right, change in the cells. As long as it doesn't cross the basement membrane, we call it intraepithelial. Means it's still in the epithelium, or CIN. So it takes about 10 to 15 years of untreated CIN to lead into cervical cancer. So it is important also to note that from CIN, not all will lead to cervical cancer, because majority of the CIN, about 70% of CIN actually will either stay or regress. Means regress from CIN3, get to back to CIN2, CIN1, or even get back to normal epithelium. Only 30% of untreated CIN3 can lead to cervical cancer, according to the previous observation. So it is important also to note, this is a very good point, important point for our counseling. Okay, sometimes patient very anxious and dapat result the HPV, also I get cancer. It's very important to understand, to explain to them that many women have HPV infection, okay, but only minority will cause CIN, and even among CIN, only minority will get cervical cancer. But that's a function of screening, in which we will we choose certain part of population, rather than we do biopsy, we do colposcopy and biopsy for all women to know about CIN. Is very not cost effective. Okay. So we take those with HPV positive, because we understand that you need HPV to get CIN. Okay, so those with HPV positive only that we choose and do the next step. I will mention later. So this is again another diagram, that if you see this green and red arrow. Okay, so actually the green arrow is those in green, actually the proportion is larger. Means from HPV get into CIN. All right. Sorry. Yes, it's the red one. So it's persistent HPV, and also that progress into CIN actually is the minority. Okay. So internet is okay. Okay, so the majority actually will regress back from CIN 2 or 3 back to the normal epithelium, because of our immunity. Okay, because our immunity of the body can stop the virus from progressing. And only minority of those in persistent CIN3, means the higher grade of CIN, that will go into cervical cancer. So as you see, another thing is the duration. It's a very long duration. It's about 15 to 20 years from a woman getting persistent HPV, then to CIN, to cervical cancer. So this is important to understand that we have many, you have, a long, very long time or opportunity for us to, even though, we miss, not to say even though they get a persistent infection and get CIN, means we are not talking about vaccination now, because we are talking about vaccination, then it will reduce even the HPV infection from the beginning. But you're talking about those even with HPV infection, we have about 10 to 15, maybe up to 20 years actually before developing cervical cancer. We have long time to detect and to treat CIN. So this is important, the importance of screening, the importance of role of primary care. That's the reason that I want to emphasize this topic today. So again, is another diagram for us to understand from HPV infection into CIN, and minority will cause invasion beyond the epithelium, that we call it cervical cancer. It take a very long time. All right.